And we are live. I'm just going to share the live stream link in our Telegram community and on Twitter, and then we can start off. Okay, here we go. Welcome to this month's live video AMA. My name is Raymond van der Waal. I'm head of marketing at Triall. And today I'll be your moderator while also answering some of the pre-submitted questions. I'm joined here today by our CEO, Adil Espai, and CTO, Niels Klomp.
Hi, everyone. Happy to be here. Looking forward to it.
Thanks for joining, guys. We'd like to thank you all for joining this session and hope that you will walk away with some new insights and perspectives on our product and vision. In terms of agenda, we will start with answering questions that have been submitted to our portal over the past week. And after that, we will have some time reserved to answer questions from the live audience. So let's get started with the first question. Could you walk us through the stages of a clinical trial from beginning to end? Where and how can researchers benefit from trial products to improve the quality and ease of their research? I'm going to give that one to you, Adil.
Yeah, thanks so much. So a very broadly defined question, but also a great one. So to start, I think with the first part, what clinical trials are and the different stages. So clinical trials are basically research studies that are performed in people and that are aimed at evaluating new medicine. They're the primary way that researchers find out if a new treatment, like a new drug or medical device, is safe and effective in people. In general, there are 4 clinical trial phases a new medicine needs to go through. First one, call it phase 1, is the first time a medicine is actually being administered or used by healthy volunteers, or people who are not sick. And there we basically look at how safe a medicine is. This is often done in a single site or a single country. This is then followed by phase 2. And this is generally done in patients that are affected by a specific disease. And there we are mainly looking at the best dose to treat their disease. This is often done at multiple sites and at multiple countries all at the same time. Subsequently, if everything goes well, we go into so-called phase 3. And there we look at larger patient groups and gather data around safety and efficacy. And this involves multiple countries often or continents. And here we really aim at generating a data package that will inform regulators whether a marketing authorization application can be granted or not. And once we have this marketing authorization, for instance, from the FDA or the EMA in Europe, or all the regulators all over the world, then this can be followed by phase 4 clinical trials. And these are studies that look at long-term safety or long-term side effects of a medicine or drug that is already, being available in pharmacies. So to the second part of the question, Trial really offers an end-to-end software platform that really means that independent of phase, our products can be used for data capture, management of documents, planning and oversights. So it doesn't really matter where in the world a study is being run, or whether it's an early stage clinical trial or a late stage clinical trial. All these elements, like I just mentioned, they are basically part of any clinical trial. And this means that researchers can now work on our platform, on our singly unified platform, and we think and we see that it brings a lot of benefits. in terms of maintaining the oversight and also staying up to date on the trial's progress and performance.
Thank you, Adil. Great answer. That brings me to my second question. What does Triall view as currently being or potentially going to be their unique value offering to the marketplace? One that would be highly profitable, proprietary, and can be licensed to other users. Will Triall develop any proprietary software, applications, systems, or patents that would give Triall a unique position in the marketplace? Niels, do you want to take that one?
Yeah, sure, happy to. Triall's unique value offering basically centers around blockchain innovation, of course, in the clinical trial field. And with the recent Crucial Data Solution partnership, we can now innovate on top of their proven platform. And this means that we can expand and improve our current offering with our blockchain APIs to promote data integrity, interoperability, and operational excellence, of course, in clinical trials. We're currently working on bringing so-called self-sovereign identity technology and standards to clinical trials. And we focus on several key areas, starting with the informed consent. We specifically have chosen the informed consent process because we see there's a lot of audit and inspection findings that result from issues related to record keeping, version controls, and signatures. So signatures not being present, for instance, signatures maybe not fully conforming. And adding to that, the informed consent process is also the very start of the patient journey. So it serves as a perfect entry point for implementing this new SSI technology. So as part of our solution, each patient is provided with their own unique decentralized identity on the blockchain. And a wallet that contains credentials they can use to provide, update, and revoke their consent throughout the study. So in the future, we will be planning to, of course, expand upon this use case by leveraging basically the same decentralized identity infrastructure for important topics such as patient recruitment, training credential for research sites, and other use cases. But what might be the most exciting use case is that we can use this SSI technology to promote the reuse of data in accordance with the FAIR data principles, which is an acronym basically for findable, accessible, interoperable, and reusable data. So nowadays, data is often generated in the context of a single clinical trial, never to be reused again. And of course, that is a waste of that data, because that data typically is important data, otherwise it wouldn't be part of a clinical trial. So we really want to change that. And using SSI technologies and standards, we can decentralize the digital identity and access management in a way that will and that adheres basically to all the privacy regulations across the globe, because there's different privacy regulations, of course, as well as industry-specific requirements. In this way, we can use blockchain technology as an overarching layer, basically, to securely connect what were previously isolated parties and systems. So you have this typical problem with integration of different systems where you can do a one-to-one integration with another external system. But you do run into the problem, of course, that if you want to integrate with multiple systems, you have to create all these different types of integrations. And that means that you sort of have this typical star type of problem where basically all these different systems have to be integrating with all kinds of other systems. And basically all those parties that are creating those systems have to do an awful lot of work to basically get integrated. Of course, having some specifications help there, but what, of course, blockchain technology brings is that different systems, also legacy systems, which might not necessarily speak the same protocols, for instance, they can use that same technology to even start talking to each other and to exchange information, to know that the information has been validated, is correct, to also use the identity data that is associated with it, because that's really a big part of the SSI technology, so that you know what the provenance of data is, but you can also, for instance, use the SSI technology to log into systems without having to use passwords. So it's also even a more safe way of working with that data. And as a user, and that's one of the last things that I would like to mention, as a user, it also means that you are in full control of your data. So you know with whom it's being shared, for what purposes it's being shared, and that it cannot be used for different purposes, for instance. So that really brings you back in control of your data. Right now, you're typically, that's not only in clinical trials, but broader as well, an awful lot of organizations are processing your data. You don't know exactly what they are processing. In Europe, there is this regulation, of course, the GDPR, so you can sort of ask for it. But with this type of technology, you can get more direct insight into what data about you is being used for instance. So we think that that will radically change the clinical trials world, of course, in the way they interact with each other, so how the different stakeholders interact, and that is all around the different stakeholders, so from pharma sponsors to patients, to clinical research organizations, to investigators, and basically, as a last thing, I guess, what is also interesting is I mentioned that all those organizations are processing your data right now, and you don't know an awful lot about it. With this technology that we are creating, it really puts you back in control, which also means that if you wanted to, you could be monetizing your own data, for instance, for research purposes. Instead of having these external organizations selling your data, you typically don't know that unless you really read some of the fine details of the agreement that you signed up for. You would now be able, for instance, to sell your own data, and that's uncharted territory for now. So that's something we really would like to look at. And I will leave it at that, because otherwise I just keep talking, I guess.
Thank you so much, Niels. I think you touched on a lot of very relevant topics there, especially if it relates to the use and reuse of data and the preserving of privacy, ensuring data remains verifiable, and also ensuring interoperability between all the different stakeholders involved in clinical research. And I think blockchain provides some great opportunities for opening up that way of working and that exchange of data. That brings me to my next question. One of the central value propositions of the TRL token is that the software and services provided to the ecosystem must be paid for in TRL. Does that mean clinical trial clients have to register on an exchange, buy tokens, set up wallets, etc.? Or does the trial team provide a streamlined method for onboarding organizations used to paying in fiat? Well, I'm going to take that one. We understand the barrier to entry must be as low as possible for new clients. I mean, the last thing we want is to make it more difficult for clients, since switching to new software can often already be considered as a big organizational change. So for this reason, we would facilitate, or in this particular scenario, we can facilitate the purchase of TRL tokens on behalf of the client, which means that we effectively emulate the token economics part, where our clients don't need to worry about setting up wallets, buying tokens from exchanges, and everything else that relates to that. Our core focus in this regard will really be to always focus on catering to the needs, wants, and requirements of our clients, since without them, we won't have a viable business. So we're really trying to make their life easier. Bringing me to the next question. Comparatively, what are the costs of using the suite of Triall software in comparison to old-fashioned non-blockchain solutions? Adil, would you like to take that one?
Yeah, sure. So I should start by saying that there are a lot of different e-clinical suites, right? There's quite crowded competition going on in the research service industry. So it's always difficult to pick the right competitor and then, compare your service offering, with those. But across the board, we see that our pricing model is in line with, the pricing model of other clinical trial software platforms. But this only tells one side of the story, because the actual costs of using legacy or outdated software that is limited in terms of features or capabilities can be significantly higher. And by that, I mean that if you're paying for a software solution that, for instance, helps you to oversee a clinical trial, if it's not A, user-friendly, B, has a wide range of capabilities that can be on a very granular level, or that can be tailored to a specific organizational need, if you don't have that, then it can be perceived as maybe ineffective and at the end of the day quite costly, even if the price of acquisition is quite low, if you know what I mean. And we are blessed with the collaboration with Crucial Data Solutions because, we've been scoping for the right partner, for a lot of time. We've looked at many different systems and we see that the CDS system is really, state-of-the-art system, and it's helping clinical trial stakeholders with conducting their work much more efficiently. And because we are innovating on top of that validated and proven platform, we feel that we can add even more value without having to increase the price too much. And the main reason for us is because if you look at blockchain and its attributes, it enables us to effectively, at the end of the day, need less time, need less resources, to do these essential activities when it comes to managing the data, when it comes to keeping oversight, when it comes to verifying data on site or remotely. So at the end of the day, our goal is not to be per se competitive on price, but to be convincing in terms of capabilities and adding value in terms of decreasing timelines, adding value in terms of increasing quality, and adding value in terms of lowering cost. That's what we strive for.
Thank you so much for the clear answer, Adil. I have another question which is related to the TRL token and our activities when it comes to business development and marketing. So I'm going to take that one. The question is as follows. I see the TRL token as being a good buying opportunity right now for investors. Separate from developing trial products and services, is Triall taking any direct actions and initiatives that are specifically focused on attracting new market investors? Additionally, is Triall currently looking at any new large investment partners, grants, foundations, or industry support, etc.? Well, I would say the short answer is yes. We consider our token as the fuel of our ecosystem, with our token holders being the engine. And what we've noticed is that the crypto space is really driven by incredible network effects. Having access to the networks of others can greatly accelerate our exposure and thereby our brand awareness, our business development, and other relevant activities. The role of our token is on one end being a means of payment for the software, but it also really allows us to tap into these network effects and enable a multi-sided business model that brings together all different stakeholders from the clinical trial space, the enterprise SaaS space, the blockchain, and the crypto domains. So let me just briefly explain what we mean with multi-sided business model. So a multi-sided business model is essentially a platform that facilitates interactions between interdependent stakeholder groups and increases in value as it attracts more users. So if you look at the trial ecosystem, the interesting thing here is that the value is really derived from the interactions between different stakeholders. Think of the pharma companies, hospitals, service providers, software providers, patients, but also within each stakeholder group. Think of interoperability between systems, think of partnerships. So by bringing all of these different stakeholders together, and with TRL being the common denominator, we can really build something that is sustainable, that is valuable for all involved. Going to the next question. Triall has a very impressive group of 12 people on its advisory panel. So the question is, how often does the advisory panel meet on average per month, and how are they contributing to the company's developments? Can you describe in more detail how Triall is stepping into this broad and collective brain trust, and what synergies and creative forces these 12 members can impact along with the core Triall team? Adil, would you like to take that one?
Yeah, sure. That's another great question that I think relates to our business and strategy, right? So I think first and foremost, it's also very nice to see that we ourselves are being invited more and more in all kinds of panels to talk about blockchain and life sciences or clinical research and how they can, and one thing strengthens the other. So it's nice to be recognized, I think, for our hard work in the past 4 to 5 years. Going back to the question, yes, we are definitely proud and grateful to have these great advisors on board, and advice from different areas of business, from product design to quality to business development. And we of course utilize and pick their brains for the areas where we feel they are the subject matter experts. And we try to bring that together as a team. Most trial advisors work with us directly. So that means we have a lot of individual meetings with them, where we plan and strategize together. And also, we try to help them to, within their own networks, within their own circles, it can be within their communities, within their companies, right? That we get the trial messaging and the trial vision and mission out there. Because we would like to leverage this network effect, where we not only take from our advice, but we also give back the ideation of how we see clinical trials, evolving over time. So we feel it's a win-win situation, and yes, we're definitely blessed to have these 12 people on board. And I can assure everybody that we are working hard to expand the advisory, network even further. We cannot have sufficient, knowledgeable thought leaders that support our mission and also help us to move to the next level.
Thank you for that, Adil. I think it really shows how our ambassadors serve, or our advisors serve as ambassadors to the trial vision and brands. Another question I have is related to our product and technology, and this time it's a short one. It is, how does Triall solve the Oracle problem? I'm going to leave that one to Niels.
Yeah, sure. So first, let me briefly explain what oracles are, because not everyone probably knows. Basically, anything providing external data to a blockchain can be classified as an oracle, because blockchains, they are blind to the real world and really depend on oracles basically for gathering off-chain data. So a blockchain by itself, typically because of its secure and reliable nature, it cannot get data. It typically cannot push data out to the world. So the Oracle problem refers to the fact that oracles basically also are reintroducing concepts of trusted third parties and centralization. And while blockchains are immutable by nature, and therefore provide, of course, verifiable proof that data was present at a certain point in time, the so-called proof of existence, and has not been altered since, they will not validate the trustworthiness of any external data that has been stored on the ledger. So this is being dubbed by computer science as garbage in, garbage out, meaning a blockchain provides an immutable record, but the content of that record, of course, can still very much be flawed or faked or be garbage, basically. So in the context of clinical trials, researchers that would purposely want to beautify or manipulate trial results would run into troubles for a number of reasons, basically. So first of all, clinical trial data is often collected through multiple independent research sites across various countries. So it's not like there's one, or typically not one single party which is doing all that work. So it would be very hard to try to manipulate everything. So most clinical trials, of course, are also double-blinded, meaning that both the researcher and a patient don't know which participants are receiving the investigative product, so the product being researched, and which are receiving a placebo, so a non-working product. So only after a process called deblinding, which happens at the end of the study, they would know which data to manipulate, of course. So this is already, of course, part of normal clinical research, basically, and with of course, as its purpose to ensure also that this doesn't happen. What the blockchain, of course, adds is that by locking data on the blockchain right at the moment when it's generated, we can protect against intentional, but also against unintentional, of course, manipulation of data further down the line. This means that all the clinical trial data is timestamped on the blockchain long before they can make sense of all of that data. It also means that they cannot change that data afterwards anymore, and it means that you can prove that certain data was there at a certain point in time, that it hasn't been added later, hasn't been edited, hasn't been removed, for instance. And lastly, what we are providing also with the SSI technology is that we can have identities for parties within the system. Of course, those can be pseudonymous, so that you don't know exactly who that party is, or that at least that's only some parties know what the other parties are in the clinical research. But the fact that we tie those identities, which can be pseudonymous, to the data as well, also means that individuals are associated with that data which is on the blockchain. So the garbage in, garbage out problem would become very obvious because you have something to explain if you know that your identity is tied to the data that ends up on the blockchain, pointing to you basically as a person. And that also incentivizes, of course, parties that use this type of technology to be fully honest and truthfully. Of course, we cannot fix any potential unwanted things that people might do, because people are still the weakest link. But then it's just explainable by a person. And I think that this will definitely help bring additional trust, of course, to clinical trials. Next to that, and that's the last thing I would like to mention, is that we're also very much looking, of course, at existing oracles like Chainlinks. We have good connections there as well. And right now, since we are very much focused on using the SSI technology and decentralizing the data at the user level, at the participant level, right now we don't have a need for Chainlink at this point in time, but we will definitely have a need for similar type of technology in the future as well. So it's an active area of research and keeping track of it.
Thank you, Niels. I think that was a very clear answer. I see there's another question, and this one is related to our token. I may not fully understand this, but it appears often that the selling price of the TRO token is quite significantly different if you compare the Ethereum-based Uniswap price with the Binance Smart Chain-based PancakeSwap price. Is there language in the smart contracts to monitor and balance these prices out regularly? This disparity could lead to arbitrage trading. Well, to answer that, arbitrage trading is what keeps the prices between chains or exchanges equal. So it's not necessarily a bad thing in itself. A small difference may occur in prices if you compare ERC20 with BEP20, and that can in part be attributed to the fees on Ethereum for trading, which are significantly higher. In general, however, the price difference between exchanges or chains are confined within a certain bound due to the arbitrage trading. That brings me to my my next question, and I think this would be a great one for Adil, considering his background in clinical research. How do clinical trials in the traditional world differ from clinical trials on the blockchain? Can you give more info by giving an example?
Yeah, that's. I think we are getting some great questions during this M&A. So fantastic. So community, keep them coming, please. I think to start with, clinical trials running on the blockchain produce data that is so-called verifiable. And what I mean with that is that blockchain allows us to create time-stamped verifiable proofs of clinical trial data. And the unique thing about these proofs is that they show that data was present at a certain moment in time and that the data has not been altered since. And in this way, blockchain can help to ensure the integrity of data basically over an extended period of time, which means that blockchain integrated clinical trials produce data that is more durable. As mentioned before, this is relevant not only for clinical trial audits and inspections further down the line, but also if we consider the reuse of trial data for future research purposes. And this is very important because during the life cycle of a clinical trial, you may want to ask a patient whether, for instance, their blood samples can be used for future research purposes, right? Because we don't always necessarily know during a specific phase in the clinical trials, what kind of side effects would show up, or what kind of investigations we would want to do based on material that's coming from the patient. So this is super important for researchers, and that explains why they are so interested in reusing, data that can still verify the integrity of that data many years down the line. It also, I think, demonstrates the value of blockchain as a reference database for verifiable proofs of data integrity and existence. So besides this concept of verifiability, the second differentiator lies in identity and access management. Going back to the example, if you want to enable the reuse and exchange of clinical trial data, we need to have a secure and privacy-preserving infrastructure to do so. And here also blockchain can play a key part by allowing or secure peer-to-peer communication channels between different clinical trial stakeholders.
Thank you, Adil. And that brings me to the last question of the list of pre-submitted questions. Again, this one relates to marketing and business development, so I will try to answer this to the best of my ability. Is it hard to onboard new clients, or are people in the clinical trial space quickly interested in trying out new technologies? Also, do you have people approaching you for partnerships as well, or is it mostly initiated by yourself so far? Well, we've actually been approached by various entities in the clinical trial domain who are attracted to our innovation in the space. I mean, we've been making quite a lot of noise with our marketing, especially last year. And what we see is that while not all stakeholders are interested in trying new things, the vast majority does understand that they need to follow and eventually adopt new technologies in order to stay competitive and in order to future-proof their business. Oh, in all of this, education is extremely important when it comes to convincing the industry about the value add of blockchain. And as part of this education, it's also very important to be clear about what blockchain is and what it's not, because in reality, many clinical trial professionals don't really know what a blockchain ledger is. They know it's some sort of database technology. They know it's related to cryptocurrencies such as Bitcoin, but they do not yet know how it can be applied in clinical trial operations or how it works together with cloud-based clinical trial software. So this is extremely important, and this is something that we are continuously working on, the education part, the communication part. How can we demonstrate the value add of blockchain with its unique attributes? How can we identify and also really make concrete how blockchain can have an impact on certain important processes, how it can de-risk clinical trial activities, and in that way reduce costs, increase quality, shorten timelines. That's something that is going to be extremely important for industry-wide adoption of these emerging technologies. I noticed that we have already arrived at almost the end of our time. I'm going to see if there might be one or two more questions left that have been submitted later today. I think this could be a fun one. Adil, perhaps you can answer this one as it relates to infectious diseases, and you have quite some experience running infectious disease clinical trials. So with the innovative idea of this project, how does Triall wishes to stand against future outbreaks or a disease pandemics in the future?
Oh, that's a great question. It's a question that is not necessarily tied to infectious disease, but I think the pandemic has taught us a few things. One of the most important things that the pandemic has taught us is that we need to change the way we work. We need to change the way we connect with our sites. We need to change the way we keep track of the progress of clinical trial, because in the pandemic, a lot of hospitals were closed. So where we generally used to walk in, look at the data ourselves, be present at site, we then experienced that this was no longer possible because healthcare professionals needed to pay attention to much more other immediate activities, which is understandable, of course. So across the study, across the industry, it has really been a major shock that we realized that we were not ready to deal with clinical trials in a setting of a pandemic. Personally, I think this was not only related, this shock was not only felt within the clinical trials, but in many other areas as well, outside life sciences, I would dare to say. Going back to the question, everybody is really looking to improve the way, we can remotely work, right? Improve the ways, get new methodologies in place, look at new technologies to make sure that we no longer are dependent of data verification activities that have to take place at site, right? That we are no longer dependent of having to be in physical proximity between an investigator and a patient. So this whole idea of using digitalization, and we also think blockchain is an important technology there. This whole idea of creating an ideal new way of working that is durable for the next pandemic is certainly something that we're looking at and thinking about on a weekly basis. So how do we help the world to become to become ready or prepared for a next pandemic? I think the first and foremost is that we take lessons learned of what went wrong in the previous pandemic period, right? To really explain the old way of working and where we had these stumble blocks and what it meant for all these research projects and what it meant for all these patients that could no longer get the healthcare or the treatment or the attention from the investigator that they did before the pandemic. So this is something I think that it needs to be made very clear that it had a major impact on many fronts. The other aspect is bring a solution forward that can help mitigate in case this happens again. And that's what we try to do with the Triall project. We try to build this ecosystem where, for instance, patients can be seen from seen or managed or coached from their home setting. They would no longer need to travel to a site to get instructions about how to use a specific new medicine, to report the side effects, for the investigator to report back or to consult or to discuss with all kinds of other experts. This will all be possible as part of the Triall ecosystem. The other element is really to not only look at how can we continue the research projects in the setting of a pandemic, but how can we be really smart about it? How can we make sure that the exchange of data is safe? How we can make sure that connecting all these different data silos or data lakes is done in a way where it's predictable, where it's validated, and where it's cost effective. So all these things you could see as pandemic preparedness innovations that we do at Triall. And last but not least, I think that these tools that we're developing, they need to be user-friendly. Right? You need to be able to look at, different functions, whether you're a patient or an investigator, from your iPad, from your phone. And a lot of these things were, to some extent, available before the pandemic, but they were not necessarily seamlessly operating in a way where the end user, can easily log in, follow where they are in the life cycle of clinical trial, get specific reports about what is that they need to do tomorrow, for the scientific assessors, have an idea of how cohorts, meaning groups of patients, are behaving, etc., etc. So there's a lot of ground to win, but definitely I think that the momentum that we've seen in the pandemic, we try to, take that with the horns and translate it into meaningful products moving forward.
Thank you. I think there was a great closing argument. Adil, Niels, I want to thank you for joining me on this session. As previously shared with the community, we're doing this every month. So by the end of June, we will have another AMA session. And again, we will try to answer your most pressing questions at the best of our ability. So thank you for joining in on this session, and see you next month.
Yeah, see you next month. Thanks everyone.
Thanks again, everybody. Thanks for hosting, Ray.